Hi, I am Dr. Elo, one of the elite ICE 50 avatars to present this course on 10 dental negligence case examples. Case #1, extractions in the infection requiring hospitalization subset. All patients were hospitalized, and of these, 8 patients died from the infections. In the severed nerve subset, the injuries were permanent, and the dentists involved did not refer or follow up the nerve injuries. Of the defendants, 51 were general dentists, and 12 were oral surgeons. Case #2, endodontic procedures. The second most common alleged negligence was due to endodontic procedures. Of the above negligence claims due to endodontic procedures, all of the defendants were general dentists. The complications included instruments left in canals, nerve and sinus perforations, air embolisms. Of the life-threatening infections, 7 were due to brain abscesses, and 1 due to osteomyelitis. Case #3, dental implants. In the implant loss subset, 2 to 10 implants were lost, and treatment planning was non-existent. The patient with the post-operative infection succumbed to the infection. Case #4, substandard crown, bridge treatment. It is difficult to categorize this group into subsets because most of the treatments included numerous complaints including open margins, overhanging restorations, and poor occlusion. All cases involved multiple units or full mouth reconstructions. Case #5, periodontal disease. There were 19 cases of failure to diagnose or treat periodontal disease in a timely fashion. All defendants were general dentists. In the majority of these cases, X-rays were not taken routinely, and periodontal probings were never recorded. Case #6, orthodontics. There were 18 total cases of orthodontic treatment complications and 14 cases in the subset of root resorption. Numerous teeth per patient were seriously affected, and the majority of these teeth were lost. Radiographs were not routinely taken. Case #7, dental anesthesia complications. This category tied with extractions for the most fatalities. There were 12 claims with 8 patient fatalities. Of the 8 deaths, 3 were children. Case #8, dental infections. There were 11 malpractice claims under this category. The infections resulted in 4 fatalities, 2 brain abscesses, and 1 case of septic arthritis. Case #9, dental injections. Of these 10 cases, 7 affected the lingual nerve, 3 involved the inferior alveolar nerve. In all cases, the dentists allegedly were made aware they had hit the nerve, but did not withdraw the needle and re-inject as suggested in the dental literature. Case #10, adverse drug reactions. In all 5 cases, the drug administered was contraindicated by the patient's medical history. There were 2 fatalities in this category. 1 defendant was a periodontist, the other 4 were general dentists. Legal release. The views expressed in this article do not necessarily reflect those of ICE 50. One must consult with their legal representatives for any and all legal advice.